Insulin injection errors are more common than you may think. In fact, in a survey, it was found that 76% of patients apply too much injection force, which can increase the risk of intramuscular injection. VD Nano 2nd Gen pen needles have a unique contoured base that corrects for different injection forces to help deliver insulin where it needs to go. Experience the difference of a contoured needle base. Consider VD Nano 2nd Gen pen needles.
Hello, good afternoon. My name is Nigel Maynard, Editor-in-Chief of Drugstore News, and welcome back to our ongoing series, DSN Speaks, where we talk to leading thought leaders in retail pharmacy. Our special guest today is Dr. Sashi Moodley, Chief Medical Officer at Walgreens Health. Sashi, how are you?
Good. Good to meet you, Nigel.
Yeah,
Thanks for having me.
perfect. Thank you for being here. Now, as I said earlier, you are the newly appointed Chief Medical Officer of Walgreens. And what challenges and opportunities do you see ahead in retail pharmacy?
Yeah, so Nigel, I'm just in the role now for 2 months, but I've actually been at Walgreens for the last 2.5 years as the Chief Clinical Officer of our US healthcare segment. And I joined just at a time that we were setting this up. And so now I'm really excited to take on this broader role that's inclusive of our US healthcare strategy, because I think there's a ton we can do when you think about how we blend, healthcare with pharmacy. And, a little bit of my background, because I think it's relevant here. I'm an internal medicine physician by training. And prior to coming to Walgreens, I worked on both the plan side and the care delivery provider side in the hospital setting, in the clinic, at home, and in virtual care models. And what I saw was, really a healthcare system that wasn't working for the majority of patients. And as we see where healthcare is going, more and more towards value-based care models, what I recognize is that we need a new way of delivering care, and it needs to be decentralized. I think the days of having patients, drive 10, 20 miles to go see their doctor or go to a hospital, hopefully we can move to a new model where convenience, access, it's paramount, and that patients can get the care that they need in a decentralized way. And that's what I saw at Walgreens and why I was really excited to join the company. And that's still true today. So in this role, as Chief Medical Officer, I really want to help realize that vision to make care accessible to communities across the country in an affordable way. But it's also, it has to be very convenient for them, and has to address kind of the root problems that we see, today in our healthcare system, and focus on getting patients, with chronic disease, the care that they need, and thinking, holistically about patients. So as I step into this role, I'm really looking forward to how we do that with the portfolio of companies that we have here, and really based on our core strength as a pharmacy, and pharmacy services that we've been doing for so long and so well.
Um, so as much as you can, or as best as you can, having been in the role for a couple of months, how do you plan to align medical strategy with the broader retail objectives of the company? And what do you think your top priorities will be for doing that?
Coming out of the pandemic, I think you saw what Walgreens can do, just in terms of the number of vaccines, the number of, tests that we administered. And what I really want to do now is take that core strength that we built in pharmacy and pharmacy services and now expand, beyond that. And you already, see us doing that with our companies like VillageMD, CareCentrix, and other services that we're building. I want Walgreens and our 8 to 9,000 stores to become healthcare destinations, for patients. We want to be that lifelong partner to patients. And so over time, what you'll see is that we'll continue to expand the set of services that we provide to patients, so that we can, realize that goal. If you think about, pharmacy just for a second, it's incredible part of, healthcare expenditure in this country. 20% or so of our spend is still around pharmacy, whether that's, retail pharmacy or specialty. And a lot of the, hospitalizations you see today, or some of the, issues patients have, is really around medication management. And so as I think about the opportunity for us, there's so much we can do by, bringing forth that, skill set and competency that we have in pharmacy, and especially, retail and specialty, and make it more relevant in some of the portfolio companies that we've acquired recently or that we're partnering with. And, that goal, again, is to become that lifelong partner to patients, while also, driving down costs and improving quality.
So my next question has two parts. And so you feel to answer it however way you want. Well, so what is the strategic shift towards value-based care, which you mentioned earlier? What does that mean for payers? And what role will Walgreens play in improving patient engagement and managing patients?
The shift to value-based care is here. I think if you look at what CMS has said, they want all patients by 2030 to be in some value-based care model. I spent a lot of my career working in value-based care models, both on the payer side and on the provider side. And it's important to recognize in value-based care, especially if you're taking full risk on patients, you're on the hook, right, for the financial cost of those patients. And so you want to make sure that they're getting everything that they need and that they're staying healthy and out of the hospital. And you really have to tailor your approach to different populations because not everyone needs the same, care model. You've got to kind of tailor it to the population that you're serving. And one of the things I learned from my experience in value-based care is that engagement is so critical, right? You can have the best care model in the world, but if you can't engage a patient, it doesn't matter. And that's where I think Walgreens can really help with our decentralized, platform of 9,000 stores. We're within 5 miles of 78% of the population. We engage patients that are not well engaged today by health plans or providers. And so we can really help move that needle for payers or other providers that we work with, including health systems. So I think there's an incredible opportunity there. And I get back to, thinking about pharmacy and the amount of, spend that we have in both specialty and retail drugs and where it's going. It's an incredible, important part of that overall health ecosystem. And I think, that's where we'll really shine. And so as I think about, our, presence here, it's only going to grow. And you've heard recently about partnership with Pearl. We're also working with providers, not necessarily that we're employing them, but contracting more with providers to help them, get better at value-based care. So I think it's an incredible opportunity for us. You're also seeing in the space now that some folks are, struggling in this space, and that's where we can also help as a kind of leading payer independent company. I think we're really well positioned to help others that also want to get into the value-based care space, but kind of need that assistance to get there. They can count on us to help them.
Yeah. Okay. My question has to do with the expanding role of retail pharmacies. Um, we know that that's happening and providing direct patient care. So, what innovative services or programs do you envision implementing to meet the evolving healthcare needs of the community?
So I go back to the pandemic, and I think you've seen what we can do and how important pharmacies and pharmacists are to the overall health ecosystem. So we want to make sure some of those provisions that were made available to pharmacists during the pandemic remain permanent. But we've built on that already, and we have a lot of new innovative programs already out there right now that are driving real value. A couple programs that I'll just highlight for you is our ambulatory pharmacy program, where we have a Walgreens pharmacist embedded in Village Medical Clinics, which is our primary care company that we've invested in. And we're seeing tremendous results when we, embed a pharmacist in that model, working in an interdisciplinary team with physicians. And, we've seen a meaningful reduction in A1C in patients who have diabetes. We've also seen a meaningful reduction in blood pressure in those patients who have hypertension. And the results are great, but are not surprising to me because I've seen these models work at scale, and I've seen what pharmacists can do when we pair them with physicians and we allow them to get more involved in care delivery. So I think you'll only see those models expand, and we want to make sure that we coordinate that care with the pharmacist, with not just Village MD, but some of our other portfolio companies that we have as well, including CareCentrix, that focuses on patients at that vulnerable period when they are discharged from the hospital, when so many things can go wrong, especially with medications. And so you'll see us, get more and more into that space. The other program I'll mention to you that we just recently launched that's taking off is our virtual care telemedicine platform. If you think about where patients go when they need help, we know that a majority of patients for non-acute, non-urgent conditions are going to their pharmacy as the first stop to get treatment. And just a specific use case, for example, a patient with urinary tract infection symptoms, they may come to one of our stores and purchase test strips to see if they may have a urinary tract infection. And previously, if they had a positive test, we may refer them to their doctor, or depending on how they're feeling, maybe an urgent care. But now with our virtual care platform that we launched, we're able to take care of that patient seamlessly. Within in a matter of 15 minutes, they can see a doctor or nurse practitioner and either text or have a live video visit. And if warranted, have that medication, an antibiotic, sent to their pharmacy. So what we're trying to do is also kind of blend the physical with the digital so that patients have that seamless experience. And for example, something like testing, which we've done so well during the pandemic and that we continue to do, patient could come to our store, get tested, and if they're positive for say COVID or flu, then complete their visit online with our telemedicine platform, and if warranted, receive Tamiflu or Paxlovid, and that can be sent to their pharmacy. They could also start that visit at home, maybe seeing a doctor first, not knowing what symptoms they have, and the doctor could say, hey, it looks like you may have COVID or the flu. Why don't you go get tested? You can go down the street to your Walgreens to get that done. And then depending on the test, we can decide what the next best step is for you. But that's kind of the care models that we're going to be working on, is really blending that physical with the digital, and making it a seamless, convenient, and affordable experience for patients. And we have a right to win. If you think about our engagement, we have 10 million touch points with patients a day across our different channels. And so we want to really, leverage those touch points into meaningful clinical interactions.
Great. Well, Dr. Moodley, thank you for talking to us today. We really appreciate it, and good luck in the role.
Thank you, Nigel.